This is another great question that I get a lot relating to stress and chronic illness, which is how do I know what my regular symptoms are and how do I know what's happening because I'm stressed? So, first, I want to define stress. Okay, when we talk about stress, stress is really the relationship between us and our environment. It could also be the relationship we're having with what's going on in our internal environment and how we mitigate that and whether or not we have the coping skills necessary to meet those challenges. So, chronic illness is an internal stressor. All right, so chronic illness itself is internally stressful. It's not necessarily a stressor that we can change or control or get rid of, but we can find ways to manage it. And then we have external stressors, things that happen just because life is lifing, and then that can cause stress, things like finances or relationships or what have you. And then our role is trying to figure out how we can manage that as well. So we know with chronic illness that most chronic illnesses do react to stress, which means that you may have your baseline symptoms and then you've got symptoms that could be worsening, or that essentially those baseline symptoms could be amplified by how much stress you have going on externally, or maybe how you're responding to or coping with your internal stress. So the biggest thing we pay attention to in therapy with stress related to chronic illness is how are you coping with your internal stress? How are you responding to or managing what's going on internally in terms of your symptoms? How are you managing and coping with the external stressors that you're experiencing? And then, because our coping responses are always kind of part that we can control and manage and change. But then also we might look at the specific stressors themselves that are going on in your life and ask, what, if any of these stressors can I control, change, reduce, or get rid of? So to differentiate these things, I would start by tracking, identifying stressors externally and internally, and track how you're coping with it and see if the ways that you're coping with it are healthy and adaptive, and which essentially just means if it's helpful, it's going to be reducing your overall feeling of overwhelm. It's going to help you feel like you're coping with it in a way that doesn't have other consequences, or are you coping with it in a way that is maybe maladaptive or not so healthy, which usually means that there are other consequences that come from that. Like if I'm avoiding going to the doctor because I feel too overwhelmed about going to the doctor, then the consequences to that might be that I'm not taking medication I'm supposed to be taking, and so my symptoms are getting worse and I'm feeling more out of control with them, right? So really identifying your stressors, identifying how you're coping with it. Usually in therapy, I have this whole cope inventory that I go through with people, and we really assess how they're coping with stress, and we come up with a game plan for where they need to focus their coping strategies, learn new ones, and adapt and adjust from there. And usually if you're coping with your stress, you are feeling less overwhelmed. You're feeling like your symptoms are more manageable, or at least they're managed by your regular course of treatment, and you're able to rise to the occasion of whatever stressor comes up, which means that you are you're able to recover from the stress, you're able to bounce back from it, or at the very least you're able to recognize where you need to say no to something, where you can say yes to something, and you feel like things are pretty well balanced. One last thing that I will add to this, even though there's so much more I could say, is that when we talk about coping with stress, there's usually three different areas that we look at with coping. We look at appraisal-based coping. How am I thinking about this this stressor, stressful situation? We look at emotion-focused coping. How am I feeling about it, and how am I coping with how I feel about the stressor? And then we talk about problem-based coping, which is really action-oriented. It's what am I doing about the stressor itself? So you could also be looking at those three things. Sometimes I find that if people can't, do anything about the problem, the stressor itself, we're left with what we think about the stressor and how we feel about the stressor, and those tend to be things that can overwhelm our coping. So we usually need to learn more thought-based strategies and feelings-based strategies to help us cope better with those two particular areas. And to kind of sum it all up, and also as just an aside, sometimes the stressor itself, the biggest thing that's creating stress, is our chronic illness. And it makes us, if our body isn't functioning appropriately, our whole stress response system can really be not working that well. And so that makes us more susceptible to the negative effects of stress. It can make us feel like we're doing something wrong when it comes to stress, even though we're not. It's just like, the equipment we're dealing with. And so I also tell people to just try to approach themselves with a dose of self-compassion. Meet yourself where you're at and do the best you can do. And as long as you are, being patient with yourself and, advocating for yourself, giving yourself breaks, breaking things down into chunks, and, doing the best you can to cope in the best way that you can, that's really all that you can expect of yourself.